Hello and welcome back. This is Dr. Amritha Shetty, your gynecologist, and today I'll be making a follow-up video on the first trimester, kind of like a frequently asked questions in your first trimester. So I've already made a video. You can check that out, and this video is kind of about the frequently asked questions, right? So without wasting much time, let's begin the video. There are several questions that patients ask when they're pregnant, especially in first trimester. So let's begin with the frequently asked questions. So first would be exercise. Is it important to do exercise, or is it allowed to do exercise during your pregnancy? Absolutely, it's very important to move your body during your pregnancy. In the first trimester, you can do exercises like walking, swimming, prenatal yoga. You can do Pilates. Okay, something in moderation is always good. Don't try and start an exercise which is totally new or unfamiliar, and exercises that can cause injury or fall is to be avoided, right? Secondly, about flights, whether you can take flights during your pregnancy. Yes, up to the gestational age of 28 weeks, you will be allowed in flights. There are flights that don't allow you to fly after 28 weeks. So please, you can visit your gynecologist and you can ask for a fit flight certificate, right? So that is about flight. You can what you have to make sure is, when you're flying or when you're traveling, make sure that you are hydrating, and even during these travels, make sure you move your body a little bit, because being stagnant can cause blood clotting, right? So that was about flight. Another important or commonly asked query during pregnancy is cramping. So is cramping or pain normal during a pregnancy? Yes, it is normal, because your uterus is growing and the progesterone that is released is causing muscle relaxation. So a lot of things are happening during your pregnancy. You can have some amount of cramping, but do consult your gynecologist and make sure that everything is okay. Next would be spotting and bleeding. A lot of patients ask if spotting or bleeding is normal. Some amount of spotting is normal, because it could just be an implantation bleeding. That is, when your fetus is getting attached to the uterus, there will be some amount of bleeding, which is normal. And about 30% of women who have normal pregnancy do have some kind of spotting throughout or in some time during their pregnancy, right? So make sure that the bleeding that you have is normal, and for that you have to consult your doctor whenever you have any amount of spotting or bleeding, right? So another frequently asked question is sexual activity. Is it normal, or is it allowed to have sexual intercourse or sexual activity during your pregnancy? So yes, it is generally safe to have sexual intercourse during your pregnancy, anytime during your pregnancy, as long as you have a low risk pregnancy. So you don't have any risk factors like placenta previa, or you don't have any leaking, or you don't have any sort of growth in the cervix or vagina, right? So you can talk to your doctor about this, and she will kind of give you a personalized solution to this, right? Next is weight gain. So is how much weight gain is important, and do you usually have weight gain during your first trimester? So these are the some of the questions that patients ask during first trimester. So first trimester, usually because of nausea and vomiting, you may not be having adequate food intake, or you might be vomiting whatever you eat. So it's usually normal to kind of lose weight during your first trimester, or even just have your same weight as your pre-pregnant state, right? So normally it is throughout your pregnancy, it's about 11 kgs that you can gain weight, out of which in the first trimester maybe up to 1 kg is normal, and the most of the weight gain happens during your second and the third trimester, right? So 5 and 5 kg each, so it sums up to be 11 kgs throughout your pregnancy. So that is that. And about food intake, yeah, so a lot of questions on what food can you eat and what not. So see, the thing is, pregnancy is usually a low immune period during your life, so you are more prone to infections, right? So the food which has, the concept is that the food that has high bacterial content should be avoided, so that you don't go through food poisoning and things like that. So raw meat or raw fish or uncooked food is something that you should avoid. For those of you who eat fish is a good source of protein and omega-3 fatty acids. So the small fishes like sardines and salmon is safe. The bigger fishes like mackerel or sharks are usually the ones with higher mercury content, so that should be avoided. Apart from that, what are the recommendations for caffeine? So about 250 milligram per day is allowed during pregnancy. So 1 cup of coffee is probably okay during your first trimester or later part of the pregnancy. But yes, always talk to your doctor for a more personalized approach. And I think with that I've kind of answered most of the queries. If you have any question, you can comment below so that I can answer them. And I hope this video was useful, and so I think that's it. So have a safe pregnancy, and do visit your doctor for the regular checkups and any queries thereafter. Thank you.